Good morning. I'm so happy you've joined us for Powerhouse, St. Michael's Hospital Foundation Speaker Series. I'm Colleen Johnston, Chair of the Board of Unity Health Toronto, the network that brings together St. Michael's Hospital, St. Joseph's Health Centre, and Providence Healthcare. To mark International Women's Day, we're doing a special edition of Powerhouse today about women and leadership. Our guests are talented physicians and skilled leaders at St. Michael's who have broken through many barriers to reach the top of their profession. It's a great privilege to know these women. They are rock stars. They gain the respect of their peers. They pay it forward by mentoring new generations of healthcare professionals. They are dedicated and courageous, and they stop at nothing to tackle the toughest health challenges and find new ways to make the healthcare experience better for our patients. They are, quite simply, powerhouse women. Unity Health Toronto is one of the largest and most prestigious hospital networks in the country. Still, we've got grander ambitions. We want to be the leading voice in Canadian healthcare and a model globally for government, for our donors, for our academic partners, and mostly for our patients. And with the women you'll soon hear from leading us at St. Michael's, that goal is within reach. And here's a neat fact. Today, our Unity Health Board has many women in key leadership roles. The chair of the board, both vice chairs, and the chair of the Resources Committee are all women. I'm sure the early leaders of our hospitals, the incredible Sisters of St. Joseph, are smiling about this, and definitely smiling about today's event. Martine will be making an announcement about a way we can all help going forward. I won't steal her thunder, but count me in. I'm going to turn it over to Dr. Seema Marwaha, who will introduce our speakers and get the show rolling. There will be a Q&A afterwards when you'll have a chance to ask your questions. Enjoy the conversation.
Thank you, Colleen, for that introduction. I am delighted to be able to share the stage, or should I say screen, with this amazing panel of accomplished female leaders. I look up to each and every one of them. Representation matters, and seeing what they've been able to do in their life and work serves as inspiration for what I can do in mine. But before we begin, we have to start with a few housekeeping notes for today's discussion. If you'd like to ask one of our panelists a question, just type it in the Q&A chat box on your screen. We'll hold all questions for the Q&A at the end of our event. If you're experiencing any technical difficulties, click the Tech Support FAQ or Tech Support chat at the bottom of your screen, and one of our techs will help you. After the event, you will be sent a few survey questions, and we would be very grateful if you could take a moment to submit your answers. Today's webinar is also being recorded. You'll receive a link to rewatch the session after the event, and we welcome you to revisit the content and share it with friends, family, and colleagues. Now let's take a moment to take a closer look at today's panelists.
My name is Dr. Najma Ahmed, and I'm the Chief of Surgery at St. Michael's Hospital. Although I never had the opportunity, the privilege to meet my grandfather, I grew up with stories about him being a physician in his community and how he provided comfort. Being a trauma surgeon gives me a front row seat to the very difficult moments in a person's life. Those moments connect us each to our own humanity and the humanity of others. And that is what is so powerful about being a surgeon.
I'm SHARON. I'm a geriatrician and clinical epidemiologist, and also physician-in-chief here at St. Mike's. Some of my earliest memories as a child are going to visit my great-grandfather in a veteran's home. And it really struck me at the time how important it is to value these older members of our population. So I fell in love with geriatric medicine. I have the best job in the world at St. Mike's, and it's because of the patients and the people that I get to interact with.
I'm Karen Wayman. I'm the Chief of the Department of Family and Community Medicine at St. Michael's Hospital. I was very fortunate to grow up in a family with two very strong female role models who pursued careers in medicine. So I grew up in a household where helping other people was very important. And at St. Michael's Hospital, as a physician and as a leader, I feel like being able to help those who come from less fortunate backgrounds and need more to be able to thrive.
Hi, my name is Seema Marwaha. I am an internal medicine specialist at St. Michael's. A big part of my job is direct patient care on the general internal medicine ward. My mission is to make sure that every person who goes through the healthcare system sort of feels like they understand what's happening to them, to their body, and help them make sense of this overwhelming situation that they've found themselves in. It's an opportunity to really make an impact in an individual person's life. And that's why I get up in the morning and that's why I come to work.
My name is Pat Ocampo. I'm the Interim Executive Director of the Li Kai-shing Knowledge Institute. I've always found designing studies and research to be a creative outlet. I found that as part of my research process, I could partner with communities and that together we could co-create studies and evidence. At the Research Institute at St. Mike's, I'm able to fully realize that research agenda.
So we're going to start off this panel talking about women and health and the pandemic and being a frontline worker during a pandemic. I myself am a frontline worker. I'm a general internal medicine doctor at St. Mike's. And what this means is that I treat patients who are admitted to the hospital with medical problems or medical issues. And I also worked on the COVID unit in wave 1 and in wave 2. But this last year, I have to say, has been a challenge for me, not only as a doctor, but as a mother and a wife, a sister, a daughter. I found myself all of a sudden navigating a new job as a new mom and then thrust into a new kind of COVID reality. The most challenging part for me, to be honest, has been the constant change. You think you know what's happening and you think you know what your job is, and then it changes again and again and again. And personally, not being able to see my parents and my sister and worrying that I might put them at risk, I mean, that has definitely been a challenge. And so for the first question, you're all leaders. You're also all on the front line of this global health crisis. Dr. Wayman, I want to know specifically from you, what has been the most challenging, or on the flip side, the most inspiring thing that you've witnessed?
Yeah, thank you, Seema. I couldn't agree more with your comments about the challenges of adapting to constant change and not being able to see loved ones. I too have found that, incredibly difficult. In addition, as a family physician, it has been very challenging to witness the impact the pandemic is having on all aspects of patients' lives and their health. So I've witnessed and supported people suffering from worsening mental illness, those that have experienced job loss, a lack of food and money, and people dealing with new diagnoses of serious medical illnesses during this pandemic. And many of them are dealing with these devastating, serious life events alone and suffering from social isolation. As a family doctor, I may be the only person they have contact with, and much of their care has been virtual to prevent the spread of COVID, which means that I can't have that contact with them, hold their hands, be there for them in person. And one of my patients that particularly stands out as a really challenging and painful experience was an elderly woman, a patient of mine who lived alone. She got COVID very early in the pandemic and was hospitalized at St. Michael's after I called and waited on the phone with her until the ambulance arrived. Unfortunately, she passed away after her hospital stay of complications related to COVID, as so many older adults have. This was a particularly painful experience as I wasn't able to provide that end-of-life care and support to her family and to her in a way that I usually would. On the flip side, now months into the pandemic, I've also witnessed many, many inspiring moments. I've seen the strength and resilience of patients, physicians, and staff in managing the constant changes and challenges, and the compassionate care that everyone has provided for patients and the support we've offered to one another. We know so much more now about COVID and how to deliver care safely and effectively. We've seen the positive impact on patients when teams and departments come together and have sufficient resources, such as building a COVID assessment center in a few days in the Li Kai-shing Institute. And then more recently, building a St. Michael's vaccine clinic in the Peter Gilligan Tower, both of which family medicine has been instrumental in leading and running, along with so many others at St. Michael's. We've been able to provide grocery gift cards, home oxygen monitors, cell phones, tablets, and masks to patients who need them. And I was touched recently by one of our family medicine dietitians who made a frozen healthy soup to give to patients who needed a healthy, warm meal. It is these acts of kindness that have gone a long way in helping us all through this very difficult year.
Thank you so much, Dr. Wayman, for that answer and for reminding us that, amongst all of this challenge, that there are also, some things that we've really been rallying to do together, like, provide patients with soup if they need it. And I think that that's really what's helping getting us through this time. I want to switch gears now, though, to science. And as scientists, many of you are also trying to find solutions to the crisis. The pandemic has had a disproportionate negative impact on women and their health and social well-being, with precarious employment and intimate partner violence on the rise, just to give you two examples of things that are affecting women specifically. Tell us what you've seen and share more about your research. Let's start first with you, Dr. Ocampo.
Yes, thank you. And I'm so glad that you brought this up, as COVID isn't only a pandemic of an infectious disease, but it's also an economic pandemic impacting a large proportion of the Canadian population. Those who were precariously attached to the labor market before the pandemic seem to have paid the highest price, with half of our lowest paid workers losing their jobs at the height of the pandemic in 2020. My research is looking at whether and how the government policies that have been put in place have covered those populations equitably. Sadly, the policies put in place, which are more like unemployment insurance style strategies versus, say, a basic income strategy, leave too many groups behind: immigrants, informal workers, gig, and others who are precariously employed. You also mentioned violence, and violence against women is another problem that has skyrocketed during the pandemic, in large part due to the reduced access to services and also the stay-at-home orders. My research team was fortunate to be able to rapidly create a new, one-of-a-kind, web-based app that specifically focused on partner violence safety planning during public health emergencies. We launched it in October of 2020. We had the help of service providers and women with lived experience in co-designing the app.
That's amazing, Dr. Ocampo, just what you were able to rally to be able to do. Dr. SHARON STRAUS, I know that you are a clinician scientist and that your work crosses both equity and gender. Can you tell us a bit about your research and what you've observed?
Yes, no, thanks so much, Seema. And similar to Pat, I think that we've witnessed really an unprecedented impact on certain segments of our population in particular. And so as you know, Seema, I'm a geriatrician and researcher, and have been involved with supporting what's going on in the long-term care homes since the beginning in March. And I know that everybody today has seen what's gone on in the long-term care homes and been distressed by it, I think, across the country and internationally. And in particular, if you look at what's going on in the long-term care homes in Ontario and looking at, for example, who's providing the direct care. So 90% of the direct care is actually provided by women, and in particular by personal support workers. These, as I mentioned, they're largely women, they're largely racialized women. They're individuals whose first language is not English. They're older than the median age of the workforce across Canada, and they're getting paid less than the workforce across Canada. And these people have been on the front lines of care during COVID. And I think, as we've all seen in the media, they've also borne the brunt of a lot of pain and anguish, as well as blame in the media in some cases as well. And so we've been working with them, in particular with the Ontario PSW Association, with the Ontario Long-Term Care Association and others, to co-create resources to support the workers in the long-term care homes, in addition to supporting the residents and the residents' essential care partners. And it's really focusing on a wraparound care approach to the staff and to make sure that they have the resources available to support them, for example, when they need to be in quarantine. So as you know, for so many of them, they're living in multi-generational households. If they get quarantined, they're still responsible for looking after, their children, their parents. They need to be able to pay their rent. They need to be able to access groceries and things. So it's being able to provide that wraparound care for individuals, as well as supporting infection prevention and control in long-term care homes, and also to promote vaccine uptake.
I mean, women, it's clear, have played such an integral role in caregiving, both in the hospital and outside of it. But your work reminds me that we need to remember who's caring for the caregivers as well. So thank you so much for sharing to you both what you've been studying. So I want to segue now into leadership and women in leadership roles. And we are fortunate at St. Michael's to have many women in leadership roles, many of whom are on this call. But as examples, Dr. Najma Ahmed is the first female surgeon-in-chief here, and Dr. SHARON, the first female physician-in-chief. And so I want to direct this next question to both of you. And I want you to tell me a little bit about what is the experience of being the first female in your healthcare leadership position at St. Michael's. Dr. Ahmed, how about we start with you as surgeon-in-chief?
Thank you, Seema. It's so exciting to be on this panel, and what a great question. I would say that these leadership opportunities have been a long time in the making, and women have been striving for these firsts for a long time, and in some cases for generations. I know that we all stand on the shoulders of women and men and people from all walks of life and from different backgrounds who have tilled this soil and laid the groundwork for all these amazing achievements that we now see at St. Michael's Hospital and in other parts of the country. I would have to say that being surgeon-in-chief at a busy academic hospital like St. Michael's is a tough job. And particularly during the COVID pandemic, it's been particularly difficult. But I would also hasten to add that it's an amazing opportunity. And I feel very fortunate to come to work every day at this great place and to work with all these amazing leaders and others at this institution. I never really intentionally aspired to this level of leadership. I guess I'm a problem solver. And I feel there's always an opportunity to make things better, to improve a problem, whether it be a workflow problem or a patient care problem. And I love working in high-performing teams. I guess that's how I ended up competing for the job of surgeon-in-chief at St. Michael's Hospital. I don't shy away from challenges, and I'm not easily deterred by circumstance. I'm enormously proud to be a physician leader at St. Michael's Hospital. I'm excited to come to work every day to do great things to make our patients healthier, to learn from the amazing people at this institution, like our patients and other members of the healthcare team in every field of medicine. It really is a privilege.
Thanks so much, Dr. Ahmed. Dr. Strauss, can you tell us a little bit about what the experience has been like for you as the first female physician-in-chief?
Thanks so much, Seema. And I would really echo a lot of what Najma has said. I feel really incredibly privileged to do what I get to do. I always say I have the best job in the world because I get to see patients and I get to interact with learners. I have an amazing, fantastic department of medicine that includes a lot of just outstanding individuals who have really been at the forefront of COVID care over the last year in the midst of many other challenges. And then I also get paid to ask and answer questions for a living. So I always tell people, like, who has a better job than I do? And I think in particular as a leader, I echo what Najma said, that I never, kind of took this on thinking, right from the beginning of my career, that I was going to be PIC one day. It was never part of my career planning. And I always tell my trainees that, I was never intentional about my career choices or anything. And, do as I say, not as I do. But I think it's about being open to opportunities and also thinking about where do you see that you could potentially make a difference and make an impact. And I've always been very passionate about trying to support people in their career development and really wanting to create a pipeline. And, my first leadership role after kind of creating my research program was in the division of geriatrics at the university to try and create a pipeline of people interested in geriatrics. And then from there, it just kind of went on to other roles. And that to me is kind of why I took this role on, is because I really absolutely am passionate about supporting others in their career development. And I see my job as helping them achieve what they want to do.
I mean, both of you guys are so generous in the way that you lead. I mean, I feel like I could come and knock on your door at any time, and you would give me advice. And so I just want to really make sure that we celebrate these leadership successes. I think they're so important. Thank you both for those answers. But of course, as with celebrations, there are also barriers to overcome. And I think we have to talk about this on this panel as well. It's 2021, and the Globe and Mail just did a feature very recently on the gender gap earlier this year. And then Dr. Strauss, you published an analysis with your colleagues in CMAJ about advancing gender equity in medicine specifically. So what I want to ask you guys, and this is going to be a popular question, so it's going to go to three of you. What are the barriers facing women in healthcare leadership positions today? How is this changing? And are there new opportunities for women on the horizon? And since you recently published in this area, Dr. Strauss, how about we start with you?
Sure. So thanks so much, Seema. So I think this is a really, really important question, especially in the context of the COVID pandemic. And there are certainly lots more opportunities for women with regards to leadership positions in academics and also outside of academic medicine. So if you compare it to even 5 years ago, 10 years ago, absolutely there are more opportunities. However, I really do worry about the impact of the pandemic. And in particular, if we look at academic medicine, for example, we know there are studies that have shown that women were much less likely to submit publications during the COVID period when compared to our male counterparts, much less likely to be able to submit grants compared to our male counterparts. And so if we think about that over time and over the last year, we have a potential of losing an entire segment of our academic workforce. And how are we going to make sure that those individuals are going to be supported as we ramp up back after the COVID pandemic? It's not just a straight, there's been this 1 year and, immediately going to be able to jump back into what people were doing before. We all know on this panel that during the pandemic, women have been at the forefront of clinical care, of the academic side of things, and also of the caregiving responsibilities. So many of the women are responsible for caring for their children, as well as sick family members and parents. And because of that, not being able to contribute or to pivot to research in the way that a lot of our male counterparts have been able to do. And I really worry that we are going to lose out a lot of these individuals from academics, from the leadership pipeline, if we don't think and intentionally develop strategies as organizations, as institutions, to support these individuals and to make sure that whatever we can do to support them in what they're doing now, but also as we recover from the pandemic, that we can do, because otherwise we're going to lose a lot of individuals.
Dr. Ocampo, I'm interested to get your take, especially because Dr. Strauss, you talk so much about research and the disproportionate opportunities. So maybe we could get your take on barriers facing women in healthcare leadership today in research.
Yes, thank you for allowing me to weigh in and bring sort of my research perspective from where I sit to this question. Gender-based gaps in general and gender-based gaps in leadership in particular are due to the biased treatment in the workplace that women get by those who are holding power, which are predominantly men. And this was true before the pandemic, and this is also happening during the pandemic. There's this biased perception around what roles are appropriate for women who are leaders, and also due to differential treatment of men and women in the workplace. And that creates these unjust gender gaps that Sharon was referring to, and that also contribute to the gaps that we're seeing during the COVID pandemic. Now, this gender inequality is currently a culturally accepted norm in many organizations, and unfortunately, too little is done to challenge these imbalances. There's certainly strong data showing that one of the top barriers to hiring women in leadership are that women are held to higher standards than men, and so they often lose out on opportunities. And there are many organizations who just aren't ready to accept a woman for the very top executive positions. And women are not immune from holding these ideas as well. It's kind of a systemic issue. But women can't solve this alone, and we need men and male leaders promoting more women in leadership and supporting their success when women do land leadership positions. I think there is some good news though, and that's that we have evidence that things are changing, as Dr. STRAUS mentioned, and you can see that by the presence of these amazing women leaders at St. Mike's on this panel.
So Dr. Wayman, you work in a department that is like reasonably represented, has good representation of women. I'm just wondering if you can weigh in on this question of leadership barriers and opportunities for women on the horizon in your area.
Yeah, thank you. Thank you, Seema, for the question. So when I started as chief 6 years ago, there were very few senior women leaders at St. Michael's. And I'm very grateful to Pat, Najma, Sharon, and other women who are now in key leadership roles, as this has significantly shifted our leadership culture at St. Michael's. So finding ways to support and promote women is still an ongoing challenge and a priority. So many women early in their careers are under great stress balancing home and work responsibilities, as women still do, as Sharon and Pat have already mentioned, a disproportionate amount of work in the home and are usually the family caregivers. And in my department and in other departments, I've seen the emotional impact that this has on women during the early part of their career, but even during any part of their career. It also makes it hard for women early in their careers to take on leadership roles and advance their careers. I personally found that after having 3 children in 4 years, that I had to say no to leadership roles and my academic productivity had to take a step back. So we need to advocate for changes in structure, culture, and provide the supports needed to allow women to thrive in their careers and leadership roles. It's also really important that we take an anti-oppression lens and ensure that Black women, Indigenous women, women of color, and other women who have faced barriers are in particular given opportunities and have the supports in place to advance their careers so that we can benefit from having women from diverse backgrounds in leadership roles. The more we can support women in their careers with novel models of leadership and advancement, the more likely we will see women VPs, CEOs, and board members involved in running our hospitals.
I love that you talked about novel models of leadership. And I think that that's a really good segue into talking about just leadership in general with the members of this panel. You're all leaders, and we know that leading is about making tough decisions, and COVID has really sort of borne that out. Can you tell us about some of the toughest decisions you've had to make? This is directed first, I think, towards Dr. Ocampo. Tell us about some of the tough decisions you've had to make, especially how COVID-19 has affected those decisions.
Yes, one of my responsibilities during the pandemic has been to determine whether, when, and how to close down research that might be putting patients, research participants, research staff, and principals, investigators at risk of contracting COVID-19 through research activities. Now, we just talked a lot about the gender inequities that are happening to women who are in academic medicine. Well, and we talked about how COVID-19 has particularly impacted their research and their caregiving duties. And experts say that the pandemic is actually going to set back women's progress in the workplace by decades. And so another group that is also suffering during this time are early career scientists, because they're struggling to get their research careers off the ground, and now their research is being disrupted. So knowing all of this makes closing down research a very tough decision. You want to, on the one hand, keep everybody safe, but you also don't want to further disadvantage women or other researchers from advancing their careers. And so closing down research to keep everyone safe, but keeping an eye on the gender equity and the career stage equity has really been one of the big challenges that I've had to face during this time.
I mean, that sounds like such a balancing act. I know, Dr. Ahmed, you had to deal with the difficult decision of surgeries and canceling them. So I'm wondering if you can tell us about some of the toughest decisions you've had to make as Surgeon in Chief, particularly during COVID-19 as well.
Yes, thanks, Seema. And building on what Dr. Ocampo said, there are so many different perspectives and disadvantages that we can see in difficult decisions that we've all had to make during this pandemic. And sometimes I think people have the perception that being a leader is something very glamorous, that leaders spend their time telling people what to do, when in fact, successful leaders are all about ensuring the success of their teams and setting a direction and a pace for an agreed upon agenda that we all agree to. I'm always thinking about what I can do to ensure the success of the surgeons, the residents, and the students in my department, and in their clinical and academic work, just as Dr. Strauss has mentioned. My success comes from their success. As you mentioned, Seema, the most difficult decisions I've had to make as surgeon-in-chief have been related to the triage of clinical care in the operating room. Because of the COVID pandemic, we've had to scale back operations to ensure that there are sufficient healthcare resources to care for COVID and other medical emergencies. This, of course, presents a wicked problem for patients who are awaiting surgery, for the health system, and for surgical leaders like myself, as we are acutely aware, however unintentional, deferring surgery for patients can sometimes make their situation worse, and sometimes much worse.
I mean, both of you have made your case that it's not all glitz and glamour. We are very lucky to have had both of you steering the ships, both in research as well as, in surgery and front lines. If you've been lucky enough to have one or several great mentors during your career, you know that you likely wouldn't be where you are today without them. Mentors are particularly important for female employees and staff like myself, who typically face more obstacles and in turn have a harder time joining leadership ranks like you've all spoken about today. So what I want to know is who mentored you and what was their most valuable piece of advice? I'm going to direct this question first towards Dr. SHARON STRAUS.
Great. So thanks so much. I was incredibly fortunate that I had a fantastic mentor during my research training, and I had done my clinical training in Toronto. So I did internal medicine and then geriatric medicine, and I started my training in clinical epidemiology. And then kind of as typical, you get told to go away for a while. And I thought, well, who do I want to learn from? And Dave Sackett had just recently moved from McMaster University, where he was kind of one of the founders of the McMaster Medical School with John Evans. And he moved over to Oxford to start a new center. And he was really one of the founders of the clinical epidemiology area. And so I thought, who do I want to learn from? I want to learn from him. I'd read about so much of what he'd done. Had never met him before. So I emailed him and asked him, if he was open to taking on trainees. And he responded within about 5 minutes to my email and was in England at the time and said, sure, come on over. And I did. And the first time then that I met him, he and his wife, Barbara, took me out for dinner at a pub called The Trout, which is also known as the Morse Pub, if anybody's a Colin Dexter fan. And he took me out for dinner and he sat me down and he asked me what I wanted to do in my career and in my life. And so I told him, and then his first response was, well, it's my job to make sure that that happens for you. And I will do whatever I can to help you achieve your goals and dreams. And I was stunned when he said that to me because nobody had ever said that to me before. And my first response was, can I believe him? Like, does he really mean it? And because I had never heard that before. And I was incredibly struck by the fact that he didn't just say it, but he lived it and he did that. And that was kind of his whole mission in his life was to help others. And all the time that I knew him, and I went to the UK thinking, I'm going to go for a year. And if I don't like it, I'll come back home. And I went and I stayed for almost 4 years. And the only thing that he ever asked me to do in that entire time was, he said, I ask that you do the same thing for others. And again, a very powerful thing, because he could have asked me to do lots of scuddy things. He could have asked me to take on different opportunities and things, and he never did. He only asked that I do that for others. And that to me was really something that I took to heart and felt that that was something that I could do for him in future. And so that to me was one of the most important pieces of advice that I got from him. And then the second thing was follow your passions, and you don't have to fit into slots that people try and fit you into. So follow your passions.
So when it comes to following passions, I have to go to Dr. Najma Ahmed with this question. I'm very curious to know who mentored you and what their advice was to you.
Yeah, how does one follow Dr. Strauss on this in this line of thinking? Everyone knows that Sharon is such a great mentor to so many women and so many men in medicine and beyond. We're really, really fortunate to have her here at St. Michael's Hospital and at the university. When I think about this, I know that both mentorship and allyship, both of them are key to helping others succeed. And indeed, I feel this very strongly in my bones for society to achieve its greatest potential and be the best place for the most amount of people. Many of my mentors were men, actually, and many of my female mentors were my peers, because when I was training in surgery, there were not that many women ahead of me, and certainly not in leadership roles. So I would cite mentors like Dr. Rutka, who's the chair of surgery at the University of Toronto, Dr. Carol Swallow, who's the chair of the division of general surgery at the university, Leanne Feldman, who I went through residency with, who is now the chair of surgery at McGill University. And anyone who knows Tom Parker knows he always gives the best advice, so I frequently seek advice from him. One of my role models, I would say, is the late Justice Ruth Bader Ginsburg. And one of my goals maybe is to be able to plank like the late Justice when I hopefully reach her age. Another of my role models is my mother. And my mother, who is not in medicine, taught me the importance of hard work, facing adversity, honesty, grit, and being a finisher. And my father instilled in me a love of learning and being very principled in the decisions that we make. More recently, I would say that one of my role models is my daughter, because she teaches me about the importance of being joyful and the importance of laughter in our life. I would have to say the most valuable advice that I've been given from a mentor or role model has been to trust myself, to be true to myself, to be my authentic self in every interaction, and to invest in myself the way that we invest in others, and to ask for help liberally, to engage with smart people, especially on the tough stuff. And I have learned that I always learn something from valuable when I seek advice and talk to someone about a difficult problem.
Dr. Ahmed, what a beautiful and personal answer. And I'm also just very excited that RBG came up in this panel, which I wouldn't have thought, but I'm so happy that she did. I think this is such an important question. I also want to direct it towards Dr. Karen Wayman as well. I want to know who mentored you, what was their most valuable piece of advice, and how do you engage and empower others who are coming up the ranks in your department?
Yeah, so I'm very grateful. Like others have mentioned, that their families were very important. Najma mentioned her mother and father instilling values and values in them that helped them succeed. So I'm very grateful to having grown up with a mother and an aunt, who were both physicians, which was not common in the early 60s. And they inspired in me the courage and confidence to imagine myself as a physician, even if my high school guidance counselors and teachers encouraged me to consider more traditional careers. And then when I was in medical school, almost all my teachers were male. And I have to admit, I didn't really think much about it until I got to my family medicine residency and my academic fellowship, when I began to meet women physicians with academic careers. It was only then that I realized how much I'd been missing women role models with careers I could aspire to. And some of these women have become lifelong mentors. And I'm very grateful to my mentors who've really, I would say, just been there for me and have always been available when I've reached out to them. And I've been sort of also grateful that they've tapped me on the shoulder when they saw an opportunity that I thought I might be interested in. Some of the advice that I've gotten from them that I have found invaluable is that when I was sort of questioning whether or not this was the right opportunity for me, just saying to me that they really believed that I could do this. They also advised me that it was okay to say not yet rather than no if the timing wasn't right for me. So their ongoing belief in me helped me take on graduated leadership roles, each of which led to other opportunities at a time in my life that worked. And you also asked, how in turn do I engage and empower others? And I have to say, mentoring others is part of my leadership role that gives me the greatest joy and meaning. As leaders, I believe we have a responsibility to use our privilege, power, and connections to create opportunities to help others thrive and reach their career goals, particularly for those who face barriers. I always make myself available if a medical student, resident, or colleague wants to discuss their career goals. And like Sharon shared in her story, I always ask, how can I help? How can I help you reach your goals? And if I can't help, I will reach out to my connections to find others who can. And as my mentors have done for me, I will regularly reach out to colleagues and mentees when I hear about or see an opportunity that I think could be a good fit. I will let them know I believe they can do it and that I will be there to support them along the way if they are interested in pursuing it.
Thank you so much for that answer, Dr. Wayman. And I just want to end this section with just telling everyone who's watching, who's an aspiring leader in their career, whether it's medicine or not, to like really listen to what these women have said and how important mentorship is in sort of your career development and figuring things out. And just know that, you know, people want to help and people want to create pathways for you, like pathways have been created for us. Now, I definitely want to segue now into talking about not just leadership, but diversity and inclusion in leadership. And this crosses not just gender and sex, but also race and equity as well. I thought I'd start with my own little anecdote, just a little chance for me to get a little story in here. But I was able to attend the Canadian Medical Association conference in 2017 as an ambassador, a new in practice physician. We were part of a delegation of new doctors to infuse into the mix of mid and advanced career physicians that attend this conference annually. And I attended the award ceremony that happened at the end of the conference. And, you know, it was a great experience. There was a mix of people, of races, of genders, you know, who participated in the conference. But at the award ceremony where leaders were recognized beyond the medical student level, so at the resident and staff and late career level, the only female to win an award was Dr. Jillian Hawker. And the award she won was the May Cohen Award for Women Mentors. So it was an award that males weren't even eligible to get. And to me, this was a stark symbol that even though things were improving, you know, we still have a ways to go. And so keeping this anecdote in mind, I want to ask Dr. Najma Ahmed, you know, what changes in diversity and inclusion have you seen over the course of your career? And where do we still need to go?
Well, that's a great question, actually, and thank you for framing it that way. The world is very different than when I began my career in surgery. Surgery, and especially surgical leadership, looked much more uniform than it does today. And likely those leaders held a much more uniform worldview than we now think about. I think medicine as a whole was much more patriarchal, with much less concern for the wisdom that patients can bring and the wisdom that non-physician caregivers can bring to the conversation. So yes, there've been a lot of advances, but we have much more work to do, and particularly to protect these hard-won gains and keep moving forward. If we are not intentional about staying on this journey, entropy will take us backwards again. We need to continually commit our focus. We need to continually recommit to our focus on equity and social justice, and to push forward on matters of inclusiveness and to invite all perspectives. And there is a need to reckon with the past, especially with respect to the health and healthcare needs of Indigenous and First Nations people in Canada, and also the healthcare needs of Black people in Canada. I want to emphasize, as has been said before, that it is essential that men and others who hold a place of privilege play an important role in advancing social justice and gender equity issues. Women and people from disadvantaged backgrounds cannot and should not be expected to do this work alone. Everyone needs to be an ally, and everyone can be an ally. Success in this area for me means that I'm not the only person in surgery who represents an intersectional and diverse perspective. Because if I'm the only one who can bring this voice, then when I'm gone or not available, then there's no one else who can bring this important lens to this conversation.
I think that's so important, Dr. Ahmed, to have clusters of people, to have them not, have the burden of being alone in this role of representation and intersectionality. I think that that's such a great segue into, going from talking about, working in medicine to our patients and who we treat. And St. Michael's in particular has taken on a bold mission to reinvent patient care experience by making it more accessible, more equitable, integrated, and individualized. But we also know that female patients as a broad group encompasses many intersections, cultures, and needs. So I want to direct this question towards first Dr. Wayman and then Dr. Strauss. What's most important in considering, patient experience to your female patients? Dr. Wayman, how about we start with you?
Yeah, the pandemic, yes, thank you, Seema. The pandemic has magnified what we already knew, that there are great inequities in people's experiences with the healthcare system and health outcomes. Women, particularly Black women, Indigenous women, women of color, and those living in poverty have been disproportionately impacted by the pandemic. And this is something that, St. Michael's really holds as a deep value, which is to ensure that everyone is getting the care that they need. And I personally have the privilege to provide care for women of all ages and from diverse backgrounds, women who are the sole providers for their families, women who work in low-paying, essential jobs, and older women living alone, some with few social supports. So addressing the social determinants along with managing women's individual medical needs is imperative if we're going to improve health outcomes. We need to be inclusive and partner with women if we want to improve health outcomes and patient care experiences. All women deserve to be seen and heard.
So Dr. Strauss, I'm interested to hear, as a geriatrician and as our physician in chief, sort of what your answer is to this question. What's most important to your female patients in regards to patient experience?
So again, I think it's a terrific question. And I always worry when I hear, when people want to develop women's health programs and it's focused on, maternal health or childcare. And yes, those are important parts of a woman. But when we're thinking about the health of a woman, it's a very broad perspective that I think we need to take. And we need to look at, prevention. We need to look at heart disease, vascular disease. We need to look at the entire individual. Women are more likely to be caregivers, and women are living longer. Women are more economically disadvantaged, and so they're more likely to require admission to long-term care. They're at higher risk of social isolation. So my women patients really want to be looked after holistically and want to be seen as an entire individual and have all of those concerns addressed. And as Karen mentioned, that, I think this is something that geriatrics shares in common with family practice, and, that we're both very passionate about the entire individual and all of the potential factors of that individual, including them as well as their relationship with others, with their relationship with their families and other caregivers. And so I think to be able to meet their needs, it's really being able to address all of those aspects of an individual.
What a fantastic answer. Thank you so much to you both for such thoughtful responses. I feel so fortunate to have been part of such a spirited discussion. I mean, we've covered everything from COVID-19 to tough leadership decisions, I should say, equity, barriers, and mentorship. But it's not fair if I'm the only one that gets to ask all the questions. And I know we have many people who have been watching this discussion who want to participate. So I think this is a great time to open it up to the audience for some questions in our Q&A portion of this event. All right, so let's try to get as many questions in as we possibly can. So our first question is from Cynthia. I'm going to direct this question towards Dr. Pat Ocampo. What would be the best piece of advice you would have given your younger self in a time where gender inequality may have been holding you back?
Yes, thank you for that question, Cynthia. I think like Sharon and Najma, I didn't necessarily plan to become a leader. And as a woman leader, you know theoretically about possible challenges, but they end up coming at unexpected times. So you're caught off guard when challenges or microaggressions happen. So I think the first piece of advice I would have given myself is to build a support network of other women who are experiencing a similar situation. I didn't have that early on, and I think I ended up suffering alone. And so many women have these experiences, and sharing and being supported by them would have been great. I do have one more piece of advice, and that is, when you become a leader, you're excited, you think change is happening, and you want lots of change to happen quickly. So my second piece of advice would be to be patient, because it's not going to happen quickly.
Thank you so much for that honest answer. I'm going to move on to an anonymous question that's a bit of a tougher topic for Dr. Sharon STRAUS. So how do you navigate and respond to microaggressions and sexism in research and medicine?
So another great question, and something I think everybody on this panel and people listening have probably experienced. And I think, first of all, it's important to recognize how significant microaggressions are and the significant impact they have on people. And I always think it's about like water wearing down a stone, so that over time, as you're subjected to these microaggressions, it has a much bigger impact, the literature shows, than a single egregious act. And partly that's because a lot of times we don't do anything in response to microaggressions, because a lot of times, when we see it or when we experience it, we think immediately, was it me? Was it something, did I mishear? Or, was it something that I did? And so the things that I've learned to do and learned from others is first of all, to speak out and say, not to, in a way that's comfortable for you. So one of the strategies that I found helpful is saying, what I just heard makes me uncomfortable. And just, saying that is often, a very simple way to kind of put an end to that, or asking them to repeat what they said. And again, that's another simple strategy, but it's about identifying those scripts that we can all use. Because I don't know about everybody else, but when I hear something, like I think a lot of times, when I've experienced microaggressions myself, I don't think of what to say until 2 a.m. the next morning. And so I think we have to develop these scripts and have the opportunity to practice them, so that we feel comfortable saying them and so that we have those scripts laid down. And so we've developed a workshop that we've done here at St. Mike's and at the U of T Department of Medicine with Katina Zanettos, who's one of our amazing general internists, called Stand Up, Speak Up, where it gives us an opportunity to kind of develop those scripts, but then to practice them. And I think that to me is one of the key things.
I always internalize things and come up with the best responses at 2 a.m. Sometimes I'll
exactly
write them down. The next question is for Dr. Karen Wayman. And the question comes from Terry. So compassion is a positive attribute for healthcare providers and one that many females stereotypically possess. But how does one balance this with the confidence and authority necessary to lead?
Yeah, thank you, Terry, for that very insightful question. And, I think if we want to be authentic leaders, it's really important that we don't pretend to be something that we're not. So I actually one of my core values in leadership is compassion. And it's something that I've really brought to, many different leadership challenges. And I have found that it actually has served me well. And so what I would say to people thinking about careers in leadership, be authentic. Don't shy away from the values that are important to you. And I think the more we do this, I think that these qualities will be seen as strengths rather than things we need to hide from. And then I think we will also enjoy being leaders because we don't feel that we're trying to pretend to be something we're not.
I think, Dr. Ahmed, earlier you said that you're going to be your true authentic self at all times. And I think that really reminds me, both answers remind me of each other. And speaking, Dr. Ahmed, I have a question specifically for you that's also anonymous. You are the surgeon in chief in a hospital where most division heads are male. Are there any strategies in place to increase the number of females in leadership positions at St. Michael's?
This is such a great question, and thank you for whoever raised it. The literature is very, very clear that diverse teams are happier, more productive, and retain the best talent. So it is a moral imperative that we do this. Beyond being a moral imperative, is essential to our success as an institution and an organization. So I very much feel that one of my jobs as Surgeon-in-Chief is to develop and support a culture where diversity is seen as a scarce and valuable resource, an essential and non-negotiable asset. Under my leadership, our search committees will represent diverse perspectives and be populated by people from all genders and backgrounds. Another important thing is that transparency in hiring, in promotion, and remuneration is very, very important to create a culture of inclusion. These ideals really have to become part of our DNA, just like the pursuit of scientific discovery and care of the disadvantaged as part of our DNA at St. Michael's Hospital and Unity Health. It also must be true that EDI be part of the fabric of life in my department and, in fact, the entire institution. As Surgeon-in-Chief, one of my jobs is to attract the best talent. And what I mean by that is recruit really great men and really great women. By that, I mean men and women who are excellent surgeons, teachers, mentors, scientists, and innovators. But I also look very intentionally for women and men who have the capacity and interest to mentor, guide, and support women and people from all backgrounds so that we create a world where diversity is the norm. Allyship is so critical, and I feel it's very important that our faculty lift others up by their words and through their actions.
Thank you so much for that answer. I have time for one quick one. Whoever gets it first. How does one stop men from interrupting in meetings or talking too long at educational events? Happy to hear your pearls.
Maybe I'll take that one, because that happens to me sometimes. So I think when I have observed this, and I think Sharon said this, you think about the answer like at 2 o'clock in the morning the next day. But at 2 o'clock in the morning the next day, I had this brainwave, and I have tried it, and it actually works. When you observe this happening to someone else, you say, excuse me, I think that Sharon's not quite finished her thought. Sharon, did you have something else to add? And then that stops that person, and in fact, the whole room. And then Sharon can say, actually, no, I was done speaking. So, it's not awkward, just in case I misinterpreted. But very often, that person, Sharon, will say, actually, yes, I wasn't quite finished. And I have a couple of more points to make, or I have one more thing to say. And this is a way of sort of not being, rude or disrupting the whole circumstance, but actually everyone in the room gets it, that somebody was interrupting or carrying on too long. And in the circumstance where I chair meetings where someone goes on and on, I will say, okay, let's hear from someone else. And I will ask someone who has been maybe a bit quiet, or I can tell from the body language has been trying to get a word in, but just hasn't had the opportunity.
I think that's what inclusive leadership is all about. I think you just summed it up right there. So unfortunately, I think that actually brings our time to a close. And I don't think I've had an hour during this pandemic that's actually gone by that quickly, so fast. I just want to thank each of the members of the panel, the extraordinary panel. It's clear that women have tremendous power to drive change in healthcare. And I'd now like to hand it over to our closing speaker, Martine Ehrman, to discuss an exciting philanthropic opportunity for women to continue to drive change here at St. Michael's.
Well, that was impressive. I'm Martine Ehrman. I am brand new to the board of directors of the St. Michael's Hospital Foundation. Like COLLEEN, I'm privileged to support such stellar healthcare professionals like Sharon, Karen, Najma, Pat, and Seema. These women are an inspiration. They are pioneers in their fields, and they are great communicators and teachers. And they are change makers who are charting the future of the care experience for the benefit of all Canadians. We all can't be surgeons, physicians, and scientists, but I'm sure that every person who has turned into this virtual event cares about the well-being of Canadians and wants to improve on the healthcare experience. And we have a great opportunity to do that here at St. Michael's. That's the very special role that philanthropists can play, and it's one that I firmly take to heart. Women have always been big givers, but traditionally it's men who have gotten most of the credit. Well, that is changing. Women are more visible in philanthropy today, and that's because the women have broken through barriers in their own right. More and more women are lending their voice, their time, and yes, their money to causes that matter to them. And they want to see how their philanthropy will benefit and influence society, culture, and their communities. If that sounds like you, and you're excited about what you've heard today, I invite you to join us in a new enterprise at St. Michael's Hospital Foundation. It's called the Power Circle. It's a group of women philanthropists who are determined to change healthcare and support global powerhouse in medical research, education, and patient care. If you'd like to join Colleen and myself, you can learn more by going to the stmichaelsfoundation.com/powercircle. Remember, there's no limit to what we as women can accomplish. On behalf of the St. Michael's Hospital Foundation, I wish you all a very meaningful International Women's Day.